guys, thank you once again for coming into my channel. I really appreciate you guys for your contribution, for your questions that you've been sending. Thank you for subscribing to my channel. Today's topic is going to be on type 2 diabetics. Yesterday I discussed about type 1 diabetics. Today I'm going to concentrate all my effort in type 2 diabetics. It's going to be kind of short. I'm going to break it into two. I'm going to do half part today, and then tomorrow I'm going to do the second part because it's lengthy. So yesterday we discussed about type 1, and today I'm going to discuss about type 2, how to live and manage type 2 diabetics. Type 2 diabetics is a metabolic disorder that result in hypoglycemia. Now remember, yesterday I did mention something in type 1. Type 1 is an immune disorder, something hereditary. Okay, so you got to differentiate between type 1 and type 2 diabetics. Type 1 is all immune. It has to do with immune system, destroying the beta cells in the pancreas. While type 2 diabetics is a disorder, metabolic disorder, okay, when your body cannot metabolize glucose, okay, that is type 2. It's a metabolic disorder. And one thing you have to understand, in type 1 diabetics, we have hypoglycemia, which is when your blood sugar is low. And when your blood sugar is low, there are symptoms that differs with type 2. So in type 1 diabetics, it's called hypoglycemia, where that is when your sugar is low, below the normal level. Then on type 2 diabetics, it's a metabolic disorder, okay, when your body cannot metabolize glucose level in your bloodstream. So it results in hyperglycemia. The other one is hypo, this is hyper. So when it is hyper, it's above. Now your sugar level in your bloodstream is higher than the normal. So you got to differentiate the two of them. So when you have hyperglycemia, when your sugar level in your bloodstream is higher, okay, it's hyperglycemia. And again, this is it's a metabolic disorder, not an immune disorder in terms of type 1 diabetics. So I'm trying to differentiate both of them. Now in type 2 diabetics, okay, when it comes to type 2, your body is unable to metabolize glucose in your bloodstreams, all right? Now, there are two things you have to understand in type 2 diabetics, all right? It has an ineffective way of using the sugar it produces to control the blood sugar in your bloodstream. The sugar in your bloodstream, all right? So it's been ineffective at using the insulin that your body produces, okay, also known as insulin resistance. Despite your body is producing insulin, it doesn't know how to use it effectively to control the sugar level in your bloodstream. That is one. And then the second part again is that it produces less than enough insulin to control the sugar level in your bloodstream. So it's of two parts. It's like one arrow going different direction, the other arrow is going different direction. Okay, so sometimes it produces insulin enough that your body needs, but it cannot effectively use it to control the sugar level in your bloodstream. And at times, it cannot produce enough insulin that your body needs to control the sugar level in your bloodstream. That is why it's metabolic. It's unable to metabolize glucose. On the type 1 on, all right, type 1 is that it's hypoglycemia. You tend to have always low sugar level in your bloodstream, and it has a different symptoms which I analyzed yesterday. But in terms of type 2, it's metabolic. You are dealing with always high blood sugar level in your bloodstreams. That is type 2 diabetics. Okay, so that is why it's metabolic, because your body doesn't know. It's like a computer. It's like there's a computer in your body. Sometimes it produces enough insulin, but it doesn't know how to use it to control the level of sugar in your bloodstream. At times, it cannot even produce enough that your body needs to reduce the level of sugar in your bloodstream. So that is why it's metabolic. So sometimes it goes right, sometimes it goes left. So that is why it's a metabolic disorder. So you got to differentiate the type 1 and type 2 diabetics. Now on the type 2 diabetics, when your blood sugar is high, it has a different symptoms that you're going to feel. And then if you're used to it, you know what to do to bring down your sugar level to the normal level. Then in type 1, when your sugar level is low, it has a different symptoms. And once your body can sense it, you know what to do immediately to bring it up to the normal level. And once you take that sugar, something that contains sugar, to bring it up, once it comes to that level, you see that symptom disappears. The same thing in type 2 diabetics. Once your sugar level is high and you can sense it with the symptoms that you are feeling, you know what to do to bring it down. And as soon as you take it, you see that your blood sugar will start coming down. And once it comes to that normal level, those symptoms disappears. All right, so that is type 2 diabetics. So it's characterized by the unable to metabolize glucose in your bloodstream. That is type 2. But there is one good thing about type 2 diabetes that is different from type 1 diabetics. All right, there's a sliver of hope. It can be reversible, but you have to put a lot of effort to reverse it. But it cannot be cured, because once your pancreas is damaged, it's very hard to get it to what it was originally to function properly. So it's like it's fluctuating. Today you are okay, tomorrow you are not okay. So you are fluctuating between the low and high sugar level. So that's one thing, with type 2 diabetics. So when you have type 2 diabetics, okay, the symptoms you are going to have is something similar with the type 1, like frequent urination. You're going to be having a blur vision. You can't see properly. These are the two common symptoms that you're going to notice instantly once your blood sugar is high. Frequent urinating within every minute, and then the blur vision. Okay, the other symptoms comes in gradually. But the one that can send you a message of worriness and say, why am I urinating all of a sudden, every second or every minute? That is, you start questioning yourself. There's something wrong with my body system that requires you to seek a medical attention. Is urinating, and then when you're having a blur vision that all of a sudden you cannot see properly, you can't even read, then you know something is happening with your blood system, your body system, that you need to seek medical attention or medical opinion to figure out what is going on with your system. So that's type 2 diabetics. One thing again, the people with type 2 diabetes are advised to avoid source of dietary sugar. Okay, if you can avoid dietary sugar, okay, that's a sliver of hope. Then you stand the chance of having it reversible, or at least control your sugar to a normal level and continue living your normal life. So you have to avoid a dietary sugar. Now, that's something I'm going to talk about, dieting. When they say dietary sugar, it does not mean it's only the sugar or the white substance you put in your tea. There are a lot of things that contains the dietary sugar that you have to avoid to attend to this level of controlling the sugar in your bloodstream. So most of the time, like when I go to the doctor, the first thing he keeps telling me is avoid dietary sugar. He schooled me, my doctor schooled me to an extent that I understand. I can feel within my body when things is wrong with it regarding my diabetics. But one thing that I'm appreciating with my doctor is that, for the past 10 years I'm living with it, but now I'm certified that my diabetes is under control. So he has advised me a couple of times that he's going to take me out of my medications, that I don't need that medication anymore. But I'm the one insisting that I want to be on that medication, because my H1NC for the past 3 years have been consistent. And I can't remember when I have any symptoms of diabetics, because I watch what I eat. I have to sacrifice a lot of things in order to get to this stage. So sometimes that is why doctors will continue advising you avoid dietary sugars in your body. Now, the good news is for many people with type 2 diabetes to stay well. If you can keep your blood sugar lower by avoiding dietary sugar, likely you never need a long-term medication. Okay, so if you can avoid those dietary sugar, there are chances that you don't need a long-term medication, and that applies to me because I listen to my doctor attentively. To an extent that I have to attend a course on dietary, because a diabetic patient, you have to know how to count your carbs, know what and what not to eat. I have to put a lot of effort in order not to be on this medication for a long time. It is hard to be taking almost 4 pills every day, consistently, in order to save my life because of the complications I'm trying to avoid. So our advice, anybody that is on type 2 diabetics, you have to avoid dietary sugars. And as I continue saying, I'm going to make a full video on dietary sugars, on dietary, what you're supposed to keep off from and what you're supposed to consume. And even if you're going to eat those things that you're eating before, or what quantity you should consume them. Because everything that you eat, okay, has sugar in them. So the question is that you have to moderate your sugar intake in your system. All right. If you stop taking white substance called sugar in your tea, and you are eating other things and thinking they are controlling your sugar level, no, that is wrong. So there are a lot of things you have to understand, that living and managing diabetes, there are a lot of things you have to put up a lot of effort to understand what goes into your mouth. So if you have an aging parent, or you have a son or a daughter, or you have a wife or husband that is a diabetic patient, is a lot of effort you have to put in order to sustain their life for a longer period of time. Okay, so type 2 diabetics is a metabolic disorder. Okay, that your body at times doesn't know how to use the insulin that it produces in abundance to control the sugar in your bloodstream, or at times it cannot even produce enough insulin to regulate the sugar in your bloodstream. So that is type 2 diabetics, and it's different from type 1 diabetics because type 1 diabetics is an immune disorder. They have similar symptoms, but one is hypoglycemia, the other one is hyperglycemia. One has to deal with lower blood sugar in your bloodstream, that you have to bring it up to the normal level, and the other one have to do with the high blood sugar in your bloodstream that you have to bring it down. So understanding both of them, differentiating between both of them, can help you to manage your diabetes effectively and live for a longer period of time. Despite it's a chronic long-term illness, but it can be managed properly. But when you tend to avoid it, that is when you have a very big problem. So let me repeat again, type 2 diabetics is a disorder, all right? It cannot produce enough insulin at times to co-regulate the level of sugar in your bloodstream. And at times, your body produces enough insulin, but it doesn't know how to use it effectively to control those sugar in your bloodstream. So it fluctuates in between. That is type 2 diabetics. And type 2 diabetics patients are always advised to avoid dietary sugars. And if you can avoid dietary sugar for a longer period of time, make it as a constant thing, you stand a chance of being taken out of medication for a longer period of time. That's one glimmer of hope of type 2 diabetics. Type 1 diabetes doesn't have that. All right, so in order for you not to migrate from type 2 to type 1, you have to avoid dietary sugars. And in my next video, I'm going to list what are those dietary sugars that you have to avoid. All right, so that is it, part 1 for type 2 diabetes. In my next video, I'll be doing part 2 of type 2 diabetes, the causes, the symptoms, and how you can prevent it. What are the risks of type 2 diabetics in my next video of part 2. So thank you once again for watching my video and for supporting me. I really appreciate it. See you next time. Goodbye.